Hello, everybody. I'm so glad to see you here today. I've been asked to speak for about 3 minutes, so I'm going to probably go a little faster than I'm used to. I just caffeinated, so let's see what happens. As you know, the state has been in a terrible fiscal crisis. We were facing a deficit for the biennium of $12 billion. That led to a lot of cutting of programs, some elimination of programs. GAU was one of those programs that was on the chopping block, and the governor had zeroed out the budget for it. I'm happy we were able to sort of rebirth the program, if you will, and it is now called Disability Lifeline. So you all have to change your thinking. Disability Lifeline now, but that's a name change. There were more substantive changes than that, and other speakers will go into detail about them, but as you know, there's the 24-month limitation. People can only receive it for 24 months. It's meant to be a temporary program. For those who have long-term disabilities, SSI is the most appropriate service. And so there's a lot in the bill aimed at getting people into SSI if they have long-term disabilities. Also, the eligibility for Disability Lifeline is tied to services, people getting services. As you know, they can receive medical services as well as mental health services. Some good news, and I don't know how many of you are aware of this, but we have, as a requirement in the bill, required DSHS to be working now to identify those clients who would be terminated in September when this 24-month timeline comes into effect. And so far, they have found that 40% of those clients are eligible for the expedited program for SSI. So not quite half, but 40%. And that will be quite helpful. So I would say we do have quite a challenge, though, because even though 40% are eligible for the expedited program and they won't lose their benefits in September, there's that other pesky 60%. And in fact, I think we have quite a challenge ahead of us, and I would even say crisis in King County. We have about 1,000 people who in September probably will be losing their benefits. And you are here and I'm here to try to figure out how we might answer that challenge, how we can reach out to those individuals and help them. I think that we have the intelligence in this room and the creativity to do that. I'm well aware that all the human services in the county are just stretched very, very thin. But I think that we can and we will come up with a plan, and I'm willing to sit here and work with you, work hard, and I thank you again so much for being here.